Have you ever received a blood report called CBC and honestly had no idea what it meant? So many numbers, strange abbreviations, and those arrows going up and down can be scary. In the next 5 minutes, I'll explain each part of the CBC blood test and what it actually means when values go up or down, in very simple language. Let's break down your blood report together. Red blood cells. Let's start with red blood cells, because these are responsible for carrying oxygen throughout your body. The most important value here is hemoglobin, or HB. When hemoglobin is low, it usually means anemia. People with anemia often feel tired all the time, weak, dizzy, or short of breath. The most common reasons are iron deficiency, vitamin B12 deficiency, blood loss, or sometimes long-term illnesses. If hemoglobin is high, it's usually not a disease. It can happen due to dehydration, smoking, staying at high altitude, or very rarely, a blood disorder. Next comes the RBC count, which simply tells us how many red blood cells are present in the blood. A low RBC count again points toward anemia. A high RBC count is often seen in dehydration or certain lung-related conditions. Then we have hematocrit, also called PCV. This shows what percentage of your blood is made up of red blood cells. Low hematocrit means anemia or blood loss. High hematocrit usually suggests dehydration or thicker blood. Now let's talk about the RBC indices, which are very useful for finding out what type of anemia a person has. MCV tells us the size of the red blood cells. If MCV is low, it usually means iron deficiency anemia. If MCV is high, it suggests vitamin B12 or folate deficiency, and sometimes alcohol-related problems. MCH and MCHC tell us how much hemoglobin is present inside each red blood cell. Low values mean the cells look pale, most commonly due to iron deficiency. Finally, RDW shows how unequal the red blood cells are in size. A high RDW usually means developing anemia or a mixed nutritional deficiency. Now let's move on to white blood cells, which are basically the body's defense system. The total WBC count increases when your body is fighting an infection, inflammation, physical stress, or in rare cases, blood cancer. A low WBC count is more commonly seen in viral infections, bone marrow problems, or as a side effect of certain medicines. Next is the differential count, which tells us the different types of white blood cells. Neutrophils usually increase in bacterial infections and during stress. They tend to decrease in viral infections or bone marrow suppression. Lymphocytes increase mainly in viral infections like flu, COVID, or tuberculosis. Low lymphocyte counts can be seen with steroid use or weak immunity. Eosinophils increase in allergies, asthma, and worm infestations. Monocytes are often raised in chronic infections like tuberculosis or during the recovery phase of an illness. Basophils are rarely high, but when they are, they may be linked to allergies or certain blood disorders. Platelets. Lastly, let's talk about platelets, which are responsible for blood clotting. A low platelet count can be seen in dengue, viral fevers, bone marrow diseases, or due to some medications. When platelets fall too low, the risk of bleeding increases. A high platelet count is commonly seen in infections, inflammation, or iron deficiency. Very high levels, if persistent, can increase the risk of clot formation. Conclusion. A CBC blood test gives a very good overall picture of your health. One abnormal value by itself usually does not mean a serious disease. Doctors always look at the complete pattern and your symptoms. So never panic after seeing a report. Always discuss your CBC results with a qualified doctor. If this video helped you understand your blood report, don't forget to like, share, and subscribe. And comment below if you want a detailed video on anemia, dengue CBC patterns, or infection-related blood reports.